Dr. Joydeep Bhomik here from Calcutta. Today, our topic is diabetes and its complication and how to combat the complication of diabetes. Now, the disease diabetes, what is it? It is a condition where the blood glucose level is elevated. There are various types of diabetes. Diabetes mellitus type 1, type 2, diabetes insipidus, gestational diabetes, and etc. Diabetes is such a condition, it can cause various type of complications. From our head to nail, every organ of the body can be affected by diabetes. Now I will tell about the gist of the complications of the main organ. Now come to central nervous system. The neuropathy and the neuritis can be occur by the complication of diabetes. How we can combat it? By using methylcobalamin, by orally or injectably, or pregabalin or gabapentin. Next, the eye. Here is a very severe complication can be occur by retinitis, retinopathy, and diabetic cataract. Now come to the how we can combat this? Time to time checkup at least 6 months. If the person can complaining to the physician there's a blurring of vision or something like that, go for a regular interval of eye checkup. Next, come to the heart, the very important organ, our pump house of our body. Here the risks of myocardial infarction, the heart failure can be occur in case of diabetes, especially in case of untreated and uncontrolled diabetes mellitus. After heart, the microvascular circulation, the atherosclerotic heart disease can be occur, the dyslipidemia can be occur. How can we combat this? Time to time monitoring and checkup of various investigation, we can be sure by this complication. Now come to the another very important organ, that is the liver. The fatty liver can be occur as a complication of diabetes. There are several types of molecule. If we can use pioglitazone, saroglitazone as an oral anti-diabetic, we can combat this. Another thing, that is the dyslipidemia. It is one of the commonest complication in diabetes. Next, I think the most commonest and most popular complication of diabetes, that is the nephropathy. Now we have jewels of molecules such as SGLT2 inhibitors, such as empagliflozin and dapagliflozin. If we can use it from a very beginning, we can combat this diabetic associated nephropathy and CKD. And another thing is that continuous monitoring of creatinine, eGFR, ACR, the basic urine test, we can discover the complications. Another thing is the gastroparesis. Various type of diabetic patients are complaining about the constipation. Constipation is one of the symbol of gastroparesis. There are various type of dysmotility drugs. We can use prokinetics such as etopride, levosulfide to combat this. Another thing we must say, every organ and every part of the body can be affected by uncontrolled, untreated diabetes, even in case of controlled diabetes. Very common infection as a treating physician, as a clinician, I have found that is the chest infection, upper RTI, lower RTI, urinary tract infection, and skin and soft tissue infection. To combat this complication, the monitoring and the early detection is the only process. Another thing we must say, India is going to be the diabetes capital of the world. So very conscious about your family history. Go for a regular checkup and combat diabetes. Thank you everybody. Namaskar.